Hi everyone, welcome to POC Nurse. My name is Gozi, and in this video we're going to discuss aspiration for the pulmonary section of the CCRN exam. So what's aspiration when we talk about the lungs? Aspiration is lung injury that's caused by any foreign substance that's inhaled into the lungs. Such substances could be chemical in nature, such as your gastric contents. They could be physical, such as mechanical things that cause mechanical obstruction, or they could also be food and oropharyngeal secretions. So what kind of aspiration lung diseases do we have? We have chemical pneumonitis, aspiration pneumonia, exogenous lipid pneumonia, and foreign body aspiration. Chemical pneumonitis is when there's chemical injury of the lungs due to aspiration of gastric contents, oropharyngeal secretions, or exogenous liquids. Aspiration pneumonia happens when there's aspiration of colonized bacteria in oropharyngeal or gastric contents. Exogenous lipid pneumonia is very unusual. It's a type of pneumonia that's caused by aspiration of mineral or vegetable oil. Foreign body aspiration is pretty much the aspiration of objects, like physical objects, into the lungs, and these could cause a mechanical emergency. I'm sorry, I mean a medical emergency if there's mechanical obstruction of the airways, and it could also cause bacterial pneumonia as well. So now, what causes aspiration lung disease? So, well, for one, we should always have control of our airways. I think if we have control of our airways, it'll be more difficult to aspirate on anything. Because if something pops into the back of your throat, you can cough it out. You can be aware that it's there and do your best to take it out. So now, if there's any kind of neurological impairment, it could cause aspiration in a person or a patient. For example, if a patient has impaired swallowing or impaired cough or gag reflex, the person is at high risk of aspiration. And these two things could happen if the patient has something like a CNS disorder, like a central nervous system disorder, or depression due to maybe medication, narcotics, due to anesthesia. The person might have neuromuscular diseases that prevents them from actually swallowing, even if they want to swallow. Drug and alcohol intoxication can also lead to impaired swallowing, depressed cough or gag reflex, and even altered consciousness. Another possible cause of aspiration lung disease is an altered anatomy. So we're talking about anything that removes the airways from normal to abnormal. For example, if you place an ET tube down a person's throat, you keep the epiglottis open. So that means something can go down there. The patient could aspirate on something easily. If the patient has an NG or OG tube, you also leave the gastroesophageal sphincter open. So the gastric contents could easily flow up out of the stomach, and the patient could aspirate their gastric contents that way. So anything that alters the anatomy in this way could lead to aspiration lung disease. GI conditions could lead to aspiration lung disease. How? For example, if we have esophageal abnormalities, let's say the patient has a fistula between the trachea and the esophagus, you could have the contents of the stomach flowing from the stomach into the lungs through the trachea. If the patient has GERD, gastroesophageal reflux disease, the patient could aspirate on their gastric contents as well. What puts the patient at risk for having GERD? When the patient is obese, patient is pregnant, or patient has hiatal hernia. Decreased GI motility could lead to aspiration. In this case, the patient swallows something, it doesn't move down as it should. It kind of sits in the lungs and it could come back up and the patient could aspirate on it. A GI bleed, vomiting could lead to aspiration because these are contents of the stomach coming up in the form of blood or vomit, and the patient could aspirate on any of these. a patient on tube feeds is at risk for having some kind of aspiration lung disease. Now, if this patient is getting tube feeds, positioning is important. If the patient is laid flat on their back and they're getting tube feeds, they could aspirate on the tube feeds. So these are some things that could lead to aspiration lung disease. Now, how does a patient with aspiration lung disease present? I think they present like most patients with lung diseases. They could complain of shortness of breath, they could complain of cough, chest pain, anxiety, and someone may have actually seen them vomiting and kind of choking on their vomit, or someone may have seen them actually inhale an object into their airways. Now, you may do your assessment and find the patient to be tachycardic, tachypneic. The patient might have a fever. Their work of breathing may be increased. They may have to breathe with accessory muscles. The patient may have a cough, or you may suction out secretions from the patient's mouth. These secretions may be foul smelling, such as foul smelling sputum. You may suction actual food from the patient's lungs. If you listen to the patient's lung, you may hear stridor. Stridor is kind of, if you heard it, you never forget it. It's croaky sound kind of around the patient's upper airway due to obstruction in that airway. So if the patient inhales an object and it's lodged in their upper airway, you could hear stridor. So these are some of the way a patient with aspiration lung disease could present. Now, I want to talk about a few things for the CCRN exam. The most common type of aspiration lung disease that could occur is that happens due to oropharyngeal secretions. The patient may or may not have an infection due to aspiration lung disease. The aspiration lung disease may be acute, it may be chronic, it could be micro or massive. And this point is especially important to note for your CCRN exam. When you look at the anatomy of the two bronchi, I hope that's the plural word for it. If you look at the bronchi, the right bronchus is less angled than the left. It is also wider and shorter than the left bronchus. So if a patient was going to have any kind of aspiration lung disease, most likely it'll happen in the right lung. It could happen in both lungs, but it rarely ever happens in just the left lung. So for your CCRN exam, you need to know that if a patient is going to have aspiration lung disease, it's most likely going to happen in the right lung due to the anatomy of the right bronchus. Moving on. Let's talk about some diagnostics for aspiration lung disease. I think the number one is imaging. You could get your chest x-ray, your CT scans and whatnot to see what is in the lungs, and you could picture or you could see a foreign body in the airways. Chest x-ray could show you infiltrates or atelectasis, could show you pulmonary edema. So one thing is imaging to tell us what's in the lungs. Another thing we could do is look at if you suction the patient, look at the secretions that you get. Do they look like stomach contents? You could also test it. You could test it for pepsin, is a gastric enzyme, to tell you if the patient aspirated on their gastric contents. You could also do a sputum culture to see what organism is causing, if the patient has an infection. The sputum culture will tell you what organism is causing the infection, and this organism could be an organism that's usually found in the stomach, to also tell you, oh, this patient aspirated on their gastric content, so the patient definitely has aspiration lung injury. Let's talk about the general management of a patient with aspiration, or a patient that could possibly have aspiration. So first, we want to prevent aspiration of gastric contents if possible. So your patients on tube feeds, you want to use positioning to prevent aspiration of gastric contents. So if the patient is unconscious We want to place the patient in a sideline position like we talked about before. The patient may need to be intubated. Avoid placing the patient in a flat position, especially if they're receiving tube feeds. You want to keep the head of the bed between 30 to 45 degrees at all times. And if you just fed the patient, let's say you're giving the patient boluses like intermittent tube feeds, after giving a bolus, you want to keep the patient sitting upright at that 30 to 45 degree angle for at least 30 minutes. Usually we clean our patients in the ICU, and before we clean the patients, we turn the tube feeds off if they're on tube feeds and intubated and they have NG tubes and everything. So that's one way to try to prevent aspiration of the patient's gastric contents. If you're going to do anything that require you putting the head of the bed down, putting the patient in Trendelenburg position, you want to turn off the tube feeds 30 minutes before you lay the patient flat on their back. And another thing is to not restrain the patient in such a way that the patient can't protect their airway if they have to throw up, if they have to vomit. So this one's more pertinent to your like your BiPAP patients where you're going to cover their nose and their mouth. So you're basically covering their airways, right? If that patient is restrained and they throw up, they can't use their hands to take the mask off and release that emesis into a container or just out of their mouth. You know, if their hands are restrained, they're going to wind up swallowing or aspirating on their GI contents, on that vomit. So this is why when we put our patients on BiPAP, they are not restrained, even if they're agitated. The most we'll do is put a sitter give the patient a sitter to watch the patient. So that is one way to prevent aspiration of gastric contents. Second thing we need to do is, if the patient does aspirate, we want to maintain their airway, ventilation, and oxygenation. So if the patient needs suctioning, we want to suction the patient. We want to stop the tube feeds if the patient is getting tube feeds. We want to give oxygen if we notice that the patient is hypoxemic, and we want to give antibiotics if the patient develops pneumonia. Finally, we want to monitor the patient for complications such as acute respiratory failure, ARDS, pneumonia, a lung abscess, and empyema, so that if any of these complications start happening, we could manage it as early and as quickly as possible. So that is it for aspiration lung disease for the CCRN exam. I hope you found this video helpful. Please like, share, and subscribe, and I'll see you in the next video. Bye bye now. Hold on.